Neurocysticercosis. Introduction. Neurocysticercosis is a parasitic infection of the central nervous system caused by the larval stage of Taenia solium, pork tapeworm. It is a leading cause of acquired epilepsy in regions where pigs are raised, particularly in developing countries. The infection can result in a variety of neurological symptoms, ranging from seizures to severe cognitive dysfunction. Timely diagnosis and treatment are critical for improving outcomes and preventing complications such as brain damage, hydrocephalus, and even death. Definitions. According to the World Health Organization, WHO, neurocysticercosis is the infection of the brain with the larval cysts of Taenia solium, leading to a wide spectrum of neurological manifestations. According to the Centers for Disease Control and Prevention, CDC, neurocysticercosis occurs when Taenia solium larvae infect the central nervous system, leading to brain cysts that cause seizures and other neurological symptoms. Risk factors. Infectious factors. Consumption of undercooked or contaminated pork. Exposure to Taenia solium eggs in fecal matter, via poor sanitation. Inadequate hand hygiene and poor food hygiene practices. Environmental and lifestyle factors. Poor sanitation and hygiene, especially in regions with limited access to clean water and sewage systems. Presence of domestic pigs in the household or community. Traveling to or living in endemic areas, South and Central America, Sub-Saharan Africa, parts of Asia. Living in areas with inadequate or no public health education on the transmission of parasitic diseases. Etiology. Neurocysticercosis is caused by the larval form of Taenia solium. When humans ingest T. solium eggs, they can develop cysts in various organs, including the brain. The cysts contain larvae that can grow and cause inflammation, leading to neurological symptoms. Types. Ventricular neurocysticercosis, cysts in the ventricles of the brain, leading to hydrocephalus, fluid buildup. Parenchymal neurocysticercosis, cysts in the brain's tissue, often causing seizures and other neurological deficits. Subarachnoid neurocysticercosis, cysts in the brain's subarachnoid space, leading to cerebrospinal fluid, CSF, complications. Intramedullary neurocysticercosis, cysts found in the spinal cord. Pathophysiology. Ingestion of Taenia solium eggs via contaminated food or water. Down arrow. Eggs hatch into oncospheres, penetrate intestinal wall, and enter bloodstream. Down arrow. Hematogenous spread to the brain, forming cysticerci in neural tissue. Down arrow. Evasion of immune response in early stages due to cystic fluid and host tolerance. Down arrow. Degeneration of cysticerci triggers immune activation, microglia, astrocytes. Down arrow. Release of inflammatory mediators, IL-1, IL-6, TNF-alpha, leading to neuroinflammation. Down arrow. Edema formation and increased intracranial pressure, ICP, causing brain structure compression. Down arrow. Disruption of neural circuits and neurotransmitter imbalance, glutamate excitotoxicity, decreased GABA signaling. Down arrow. Clinical symptoms manifest, seizures, headache, focal neurological deficits, cognitive dysfunction. Down arrow. Potential long-term effects, chronic epilepsy, hydrocephalus, neurodegeneration, persistent inflammation. Clinical manifestations. Seizures, often the first sign. Headaches. Focal neurological deficits, example motor weakness, visual disturbances. Cognitive impairment or personality changes. Hydrocephalus, if cysts block the flow of cerebrospinal fluid. Nausea and vomiting, due to increased intracranial pressure. Meningitis-like symptoms, inflammation of the meninges. Visual disturbances, if cysts are located near the eyes. Diagnostic evaluation. History taking. Travel history to endemic areas. Consumption of pork or exposure to contaminated food/water. Presence of seizures or other neurological symptoms. Physical examination. Neurological assessment, mental status, reflexes, motor strength, coordination. Signs of increased intracranial pressure, ICP, or meningitis. Laboratory and imaging tests. CT scan/MRI, detect cysts or lesions in the brain. Serological tests, detection of antibodies against Taenia solium. CSF analysis, to detect inflammation or infection markers. Biopsy, rare, but used in uncertain cases where other diagnostic methods fail. Medical management. Pharmacological management. Anthelmintics, albendazole or praziquantel to kill the cysts. Corticosteroids, to reduce inflammation and control symptoms associated with cyst degeneration. Antiepileptic drugs, AEDs to control seizures. Analgesics and antipyretics, for symptom management, including pain and fever. Surgical management. Surgical removal of cysts. In some cases, cysts may need to be surgically removed, particularly in cases of significant brain damage or hydrocephalus. Shunting, to relieve hydrocephalus by draining excess cerebrospinal fluid. Dietary management. High-protein diet to support immune function and recovery. Balanced diet rich in vitamins and minerals, especially B vitamins, and antioxidants to support brain health. Adequate hydration to manage fluid balance, particularly for patients with hydrocephalus. Nursing management. Nursing diagnosis, risk for altered consciousness. Related to neurological impairment caused by cystic lesions in the brain, increased intracranial pressure, ICP, and seizures. Interventions. Regularly assess the patient's level of consciousness using tools such as the Glasgow Coma Scale, GCS. Monitor for changes in neurological status, including mental status, pupil response, and orientation. Implement seizure precautions, example padded side rails, suction equipment, and oxygen at the bedside. Provide a calm, quiet environment to reduce stimulation and minimize confusion. Educate the patient and family members on the importance of monitoring for changes in consciousness and seeking immediate medical attention if changes occur. Nursing diagnosis, risk for seizure activity. Related to the presence of cysts in the brain and the associated inflammatory response. Interventions. Administer prescribed antiepileptic drugs, AEDs, as ordered, example levetiracetam, valproate, to prevent seizures. Assess for signs of seizures, example muscle twitching, loss of consciousness, and document the frequency, duration, and type of seizure activity. Provide safety measures during seizure activity, example protecting the patient from injury, turning them on their side to prevent aspiration. Educate the patient and family on seizure management and the importance of adherence to prescribed AEDs. Place emergency seizure equipment, such as oxygen and suction, at the patient's bedside. Nursing diagnosis, risk for increased intracranial pressure, ICP. Related to the inflammatory process and potential cyst-induced brain swelling. Interventions. Monitor vital signs regularly, especially for signs of increased ICP, example elevated blood pressure, bradycardia, altered respiratory pattern. Elevate the patient's head to 30 degrees to reduce ICP and promote venous drainage. Implement measures to reduce stimuli, example limit visitors, dim the lights, minimize noise. Monitor neurological status closely, including changes in pupil size, reaction to light, and motor function. Administer corticosteroids, example dexamethasone, to reduce brain inflammation, as ordered. Nursing diagnosis, impaired physical mobility. Related to neurological deficits such as muscle weakness, paralysis, or decreased coordination from brain cysts. Interventions. Assess the patient's level of mobility and strength regularly. Collaborate with physical therapy to develop an individualized rehabilitation plan. Encourage active and passive range of motion exercises to prevent muscle atrophy. Assist with activities of daily living, ADLS, as needed, including positioning to prevent pressure ulcers. Educate the patient and family on exercises to improve strength and mobility. Nursing diagnosis, impaired verbal communication. Related to cognitive dysfunction or speech deficits due to cysts affecting areas of the brain responsible for speech and language. Interventions. Assess the patient's ability to speak, understand speech, and follow commands. Implement speech therapy for patients experiencing difficulty with verbal communication. Provide alternative communication methods, such as picture boards or communication devices, as needed. Speak clearly and slowly, using simple sentences to facilitate understanding. Encourage the patient to express themselves, and ensure that caregivers and family members are trained in effective communication strategies. Nursing diagnosis, imbalanced nutrition, less than body requirements. Related to difficulty eating or poor appetite due to neurological symptoms or medication side effects. Interventions. Monitor nutritional intake and weight regularly to assess for signs of malnutrition. Collaborate with a dietitian to provide a high-calorie, high-protein diet to support immune function and healing. Offer small, frequent meals if the patient has difficulty eating large portions. Monitor for signs of dehydration, especially in patients with vomiting, fever, or excessive sweating. Encourage the patient to eat nutrient-dense foods such as fruits, vegetables, and lean proteins. Nursing diagnosis, risk for infection. Related to the presence of cysts and potential for secondary infections, especially if the patient is immunocompromised. Interventions. Monitor for signs of infection, such as fever, increased white blood cell count, or localized pain. Maintain strict hand hygiene practices, both for the patient and caregivers. Administer antibiotics or antifungal medications as prescribed, particularly if secondary infections are suspected. Educate the patient and family on proper hygiene practices, including the importance of hand washing after using the restroom and before eating. Nursing diagnosis, deficient knowledge. Related to lack of understanding of the disease process, treatment regimen, and prevention measures for neurocysticercosis. Interventions. Provide educational materials about neurocysticercosis, its causes, and treatment options. Offer clear explanations of the prescribed medications and their purposes, emphasizing the importance of adherence to the treatment plan. Provide information on the prevention of reinfection, including proper food handling and hygiene. Ensure family members understand the patient's care needs, including seizure precautions and mobility assistance. Address any questions or concerns the patient or family may have about the disease and treatment plan. Prevention. Improved sanitation, ensuring access to clean water and proper waste disposal. Health education, promoting proper hand washing and hygiene to reduce transmission of eggs. Food safety, ensuring pork is thoroughly cooked to prevent ingestion of larvae. Vaccination, for pigs, vaccinating pigs to prevent T. solium infection. Surveillance and control, monitoring and treating infected individuals, particularly in endemic regions. Complications. Seizures and epilepsy, in up to 60% of cases. Hydrocephalus and increased intracranial pressure. Cognitive dysfunction, including memory loss and personality changes. Paralysis or motor dysfunction. Blindness, if cysts affect the eyes. Death in severe, untreated cases. Psychiatric symptoms, agitation, depression. Conclusion. Neurocysticercosis is a significant public health issue, particularly in regions with poor sanitation and widespread pig farming. Early diagnosis and appropriate treatment are essential to reduce the risk of seizures, cognitive impairment, and other neurological complications. Preventive measures, including proper hygiene, vaccination, and food safety, are crucial in controlling the spread of this parasitic disease. With prompt medical care and interdisciplinary management, patients with neurocysticercosis can often achieve favorable outcomes.